CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipti Desai.
Hello, everyone. Welcome to The Future of Health with CareAsOne. I'm Dr. Dipti Desai, the director of CareAsOne and the host of this podcast series. For those that are new to CareAsOne, it is a large virtual community that jumpstarts innovation acceleration by bringing together various stakeholders in the care cycle, from providers to payers, pharma to clinical researchers, startups, innovators, investors, universities, and more. The mission of CareAsOne is to truly accelerate adoption of innovation by creating a connected healthcare community where the patient is at the center of care. And this entire ecosystem comes together through knowledge sharing with the help of healthcare luminaries and thought leaders like the one you will meet today to discuss the challenges, the gaps, solutions, and the transformations that are essential to make healthcare whole again. This interaction and networking between the stakeholders is made possible through summits, webinars, roundtables, leadership circles, and podcasts. In today's podcast, I have the privilege of being in conversation with Inderpal Kohli, Chief Information Officer at Englewood Health. Inderpal has been a leader in information and health technology for over 20 years and has extensive experience in planning and implementing information systems to support clinical and business operations that are aligned with the hospital's strategic priorities. In the past, he has served as Assistant Vice President at HSS, the Hospital for Special Surgery, where he led the implementation of enterprise-wide information systems. To me, the most important was that he was instrumental in developing and deploying a digital pathology solution. I would say it was one of the first in the country, and it was amazing. But I think that's a conversation for another podcast or a webinar. But one very impressive thing I just recently learned is that he teaches health IT at Cornell Medical College in New York, where he passes on his knowledge to the next generation, a very noble thing to do. So in this podcast, I'm really looking forward to discussing with Inderpal the transformation of healthcare, specifically moving towards digital and connected care. As we all know, the pandemic has changed the way we do care, and there are a lot of ripple effects that we see in patient behavior and experiences. And data has become very crucial. It's become one of the most important building blocks of patient-focused approach to healthcare, where it helps providers streamline operations, understand what the patient needs, helps build loyalty and trust, and offers a better user experience. So with all of this change that is happening, I have to say, Inderpal has been in the center of this movement of change, and he has done some fascinating work in healthcare. So I don't want to take away his thunder. I would like Inderpal to tell us and the audience here about his journey in healthcare, and specifically, Inderpal, can you touch upon the current role at Englewood Health and what you do?
Sure. Well, thank you, Dipti, and hello to all the viewers. I'm really honored and glad to be part of this discussion. Really, the discussion is at the core of, I think, where all of us spend most time these days, right? The digital transformation of healthcare. So to that effect, I'm really excited for our conversation later today. So you asked about my journey. The journey started over 20 years ago in healthcare IT. You know, I'm a software engineer by background. Really started my career writing software programs for banking and financial sector. But one fine day, I landed at Columbia University Medical Center with a consulting assignment. It wasn't really something I planned for, but I think I discovered that I landed at one of the best places where a lot of cutting edge informatics research was going on. It was quite fascinating to me coming from a non-medical background, that how, all the research in the lab transforms to a bedside care. And, and that point, I made a conscious decision to stay in healthcare IT. And I'm so glad I did. 20 something, 1 years later, I have no regrets. I'm glad to be part of this healthcare IT moment. While at Columbia, I really worked on several large initiatives, including really setting up a clinical research infrastructure, several of NIH initiatives, clinical trials management system. But as I said, that was a right window into from a bench to bedside. And then I made a transition into what we call bedside here, like working for hospital for special surgery. The shift was different, right? The cycle was much stronger, much shorter. There's no research involved. HSS, like most of the hospital, was working with a lot of vendor and their products. We configured the products, review the workflows, and bring the technology to a clinician. So that was a very rewarding experience, because you have an ability to affect a patient care, and things are moving at much faster pace. So at HSS, I implemented several clinical solutions, including Epic EMR, imaging technologies. You touched upon digital pathology, but I've been part of several solutions in the imaging space, medical device integration, mobile technologies. We rolled out mobile technology for our nurses, which includes really, all the patient care initiatives like Rover, alarm management, communication, a really robust solution for them. Which brings me to my role here at Englewood. Role as a Chief Information Officer is really a role of a thought leader in technology domain these days, right? The goal is that your run part of operation is running smoothly, right? Whatever you need to do to make sure that it runs. But really what you're doing is looking ahead. And that's what my primary role is, really, to align the technology portfolio work with an organization's really strategic initiatives, growth. This is a growing organization, and really develop some pioneer technology initiatives. We are, like most organizations, looking at digital engagement all over again, because everyone implemented several digital solutions over the last few years during COVID. And now, most organizations are stepping back and looking at a holistic view of what needs to be done in terms of digital engagement, where our initiatives should align. And so we are in the process of that. But overall, I'm pretty excited about the role we are playing, and pretty excited about what's yet to come in the healthcare IT space.
Yeah, you were like one of the pioneers, right? Many people began this journey, and pandemic was the trigger, but you were like ahead of the game even prior to the pandemic, implementing it at HSS and talking and discussing, like you said, at Columbia.
Right.
And this massive digital transformation, this rapid adoption of technology was really much needed, and pandemic, kind of accelerated this whole journey. And the whole premise probably was to save money, to control costs, but more importantly, to save patient lives too. And that's such an important thing. And that's what you said, that the reason you moved to this area was to create an impact, to have an effect, right? You could have done, as a software expert, you could have done anything. You could have joined any vertical, but this was the most meaningful of all. So, talking about that, you mentioned that you talked a little bit about the work and what your team is envisioning on executing to transform this technology landscape at Englewood. But can you go into any specifics on what is it that you're looking to transform? What is it that you're looking to execute in the next few years?
Sure. If it's okay, if I can take a few minutes to describe Englewood, who we are and what do we do.
Sure.
That will give you some context on, what we're trying to accomplish. So we're an acute care hospital, single hospital, and then we have 100+ physician practices in neighboring 6 counties and spread across 3 states. We have several community-based imaging centers, breast, cardiac, or general. and several other hospital outpatient departments in the community. From a hospital perspective, we have 277 beds. We have 49 bassinets because we deliver babies here, which is new for me, coming from a super specialty hospital. I think last year alone, we delivered 3,000 babies. Extensive outpatient network, physician practices for primary care as well as specialty care, cardiology, GI, orthopedics, neurosurgery. We have 1,200 plus medical staff members, really advancing the mission of patient care. And I would say in state-of-the-art facilities and patient services. We have over 2 million outpatient visits within our providers, patient visits. It's a significant number to sink in. And in addition, about 1 million plus patient visits in our extended physician network. So a lot of visits happening in the ambulatory setting, right? So that I think is the premise of what we need to do. So a single hospital, it's some way easier to wrap your arms around a physical single hospital system and manage the care and technology there. But just imagine doing this in a model where there are 100 satellite locations. So the key to that is two-part, I would say. One is our single EMR across the enterprise. So single patient view across the enterprise. And for most part, our EMR is standardized, except when it's needed for a very specific specialty-related build. So what it allows is for all our users, physicians, a seamless access, a similar access, a familiar setting. The other aspect is, of course, every hospital will extend their network, but there's more to that, extending your network to all these facilities, extending your support model. So we have standardized hardware, standardized in many ways as much as possible, standardized patient flow, standardized intake process. All those things help create a familiarity, help people who move from site to site, help users, and also more importantly, helps patient because they can expect a similar experience. So that's at the heart of what we do at Englewood. You talked about really initiatives. I mentioned, right, the digital transformation is, we are now really looking at, right, a new way of delivering care. 2 or last 3 years now, almost, a lot of digital initiatives were implemented during pandemic because they were needed. Now we are taking a step back and holistically looking at our strategy and to develop our roadmap. And some existing vendors still remain with us. Maybe we'll bring more vendors, but I think that's what we want. Before we keep adding mishmash of vendors and solutions, we want to take an approach and develop a roadmap. We're live on Epic for 3+ years, but we are also implementing 2 of the last modules of Epic, Cupid and Lumens, so which will bring much weighted tools and structured reporting for our cardiologists and for GI surgeons. So those 2 modules are in progress too. The philosophy at Englewood has been mostly, as it came to Epic implementation, I touched on this earlier, is standardizations, follow foundation system best practices. So again, a new way of thinking for me, right? You work for a single specialty and then you tailor your system to work for that specialty practice, but you work for a multi-specialty hospital, you may not be able to tailor. So then you try to find a common cause in between. And that's what we try to do here. Use Epic Foundation, see which workflows can be standardized across the enterprise and, try to minimize the custom build, so to say. We have a training philosophy is to specialist train specialists. So a PA will train the PA, the physician will train the physician, and our teams just provide support. So that always helps. And if you have experience working with individual physician practices, they don't have patience for long drawn rollouts. So speed is the key. So we try to go live quickly, then stabilize and later optimize. But the key is that on a day of a cutover, we plan, the transition occurs as planned, they're able to see their patients. So slightly different environment than a hospital where probably we have a little more leeway around these things.
Yeah, no, I think you mentioned something very interesting. Agile, be agile, and then stabilize, and then optimize. You have to take it all together, right? I mean,
Yes,
it's very
that
exciting.
yes, it is because I explained to you, like, if I'm implementing EMR in a hospital, I have a little more time. But from a practice perspective, who's joining our network needs to start seeing patients on the day of cutoff. We don't have much leeway in terms of changing the date. Right? The contracts are signed, the insurances are converted. So there's a lot more that is at stake than just delaying your system. So our goal is to quickly implement the most stable and successful model, and of course, work with them to optimize. Two other things I will make. Sorry, go ahead.
Oh, no, I was going to say, you also brought up another very important point is difference, transformation is different from different hospital systems. Each hospital system's requirements are different. And you mentioned what yours were, right? And so depending on the level or stage of that transformation that your hospital is in, you have to either focus on process transformation, business model transformation, or domain, or even cultural transformation, right? And because of all of that, you're going to have some hurdles that are happening, and you need to overcome those hurdles that are resulting in this resistance in this change that you would like to bring about, right? So I know I cut you off, but it would be great if we could hear a little bit more about that too. What are the kind of hurdles, and more importantly, what are you seeing as change?
For the transformation, and I don't want to miss bragging on something, so I want to go back to say that I will add one more thing, which is again, staying with the pioneer theme. We implemented the first in the nation Zoom unified communication solution at hospital here in Englewood. And when I say first in the nation, first for any hospital in the nation. So our Zoom meeting platform and desk phone and mobile phone used by my clinicians and facilities and everyone is all integrated one single platform. The Zoom phone is available also as a soft phone on my computer. So just think about a remote workforce. They don't need to forward it. They don't need to carry the phone home. They can just use the soft phone. So, and we have a strong partnership with Zoom, which we are very proud of. Now I will answer your question. Sorry, I just wanted to put that plug in.
No, I just wanted to say that was really amazing that mobile messaging systems were not available for the longest time. You had to do like phone calls and all of that. And these omni-channel platforms, data integration, this clinical decision-making that is rapid, using of this, it's all technology in action. And Zoom is an amazing product that has been implemented, and congratulations for being the worst.
Thank you. And it has its own challenges being the first, but I think, as I said, a strong partnership really helps, where I have the full complement of Zoom behind me making us successful, and we overcame several hurdles, and we are live right now.
Yeah. No, it's very exciting that y'all adopted Zoom, because Zoom was a newbie with the large gorillas being there. There was WebEx in the world. There was Citrix's product out there, GoToWebinar. And then Zoom comes along and made it so radically different, so easy to implement. And look at it today. It's the largest communication means for almost everybody in the world. So.
It is. And, and then, again, the goal is to consolidate vendors, and otherwise we'll have an Avaya or some other SIP-based phone platform to have an integrated solution. I'm sure we will see a lot of benefits as they develop functionality in future. So I think we all are looking forward to that.
And you pointed out another important thing, consolidation, right? Every time I talk to people, I always hear this thing about, there's so many point solutions out there. They're really amazing point solutions, but to implement that, it becomes very, very challenging, because integrating all of those and making them all work together is the biggest issue that people face. So, I mean, I would love to hear a little bit about that. What do you think is the solution for something like that, where you have so many great solutions and they only do one thing? How can we bring them all together to kind of truly solve the problems that you have?
So it kind of reminds us where we were before single vendor EMRs were implemented, right? Most hospitals were best of breed solutions, and then we will set up interfaces to exchange messages. And 15 years ago, this whole shift occurred to convert them to a single EMR platform, one patient view across the enterprises. And to your point, now the ecosystem has changed again. At least that's what I noticed, especially at the last HIMSS, that there are so many vendors who are bolt on to these EMRs. And the difference is they have figured out that it just needs to work seamlessly within your EMR, so no one is doing double work. But for a healthcare provider looking for solutions, the assortment of choices are there, right? And then do we want to just implement a solution offering, a vendor product offering one solution versus more holistic approach? And I think that's what we are doing. I'm no different than every other healthcare leader who's bombarded with tons of product offerings every week, right? To solve either the payments or patient intake or text communication or scheduling. And so that's what we are doing. And I would recommend every organization does, like, at least look at your holistic strategy. What do you want to do? Develop some roadmap and make a conscious decision of a collection of vendor partners you will use, right? But I would prefer to go with a vendor who has at least in the roadmap developing more than what they're offering today. So I think those are really important aspects of today's ecosystem. There is no Epic or Cerner equivalent in digital ecosystem today. It's all a collection of best of breed solutions.
Yeah, so true, so true. I mean, again, Epic and Cerner came about because there was a problem and an unmet need that needed to be solved, right? How do you do payments? How do you do revenue cycle management? And it really solved it for that. Similarly, for this whole clinical decision making and for everything and creating this patient 360 and solutions, there has to be something like some kind of a platform that needs to be created. I don't know what is the right way of doing it, but there is a need over there, and your recipe for developing a successful digital transformation strategy will fit your organization very well. But how does it fit other organizations? I mean, if you have any thoughts on, is there going to be like a one size fits all, or is it going to be like something that needs to be modulated and customized for every organization out there?
So I think every organization will have a slightly different need. As I explained, my environment is 70% plus ambulatory, and I feel that's where the care is going, right? Hospital, you come to hospital only when you really need that very sick care, very specialized care. For all other needs, go to your really neighborhood clinic or your physician, or we bring care to you. I think that's where the ecosystem is moving. So when I look at digital transformation, I look at more from that 70% first and less from a hospital. Now, it all has to seamlessly bind together. But you asked about, is there a recipe? I would say that in my mind, there are a couple things which are universally applicable to every organization. And it's no surprise. It's about leadership. And digital transformation needs more leadership than ever was needed for EMRs. And I'll explain in a manner that EMR adoption was a big challenge in hospitals 15, 20 years ago. Right now it's second nature. Yes, the goal of EMR always was to, in the end, offer better patient care to patient. But the stakeholders who were affected largely by EMRs were clinicians, right? The staff of the hospital or the caregivers were the one affected. And so you have to have a leadership across where you try to map their workflows, try to find efficiencies in their workflow, work with them in developing the solution. Digital transformation affects patient. So, prior to EMR adoption, affected patient in a little manner, right? Mostly pre and intake scheduling and some with discharge. For most part, their experience with healthcare was analog, right?
Yeah.
It was the clinician sitting behind the computer, collecting all the data points and giving you the best care. Now that has shifted to patients, so clinicians will see the change, of course, but it's a patient first who is driving for that change. And that is where leadership comes in play. You really need to be a leader at all level. The organization leadership needs to set direction, which my leadership is doing. I'm so glad for that. But then this needs to propagate at all levels, right? The department chiefs, the division chiefs, the line manager, because when we initiate this digital transformation, the patient will start using it, and you will start getting all the data and work queues filled, right? Then you need to align your operations to really work those queues. And I'll take a minute and give you an example here, right? If we do the intake correctly, the patient is coming for a CT exam with contrast. The patient indicated their allergies, indicated their fasting status or not. If no one is really looking at that ahead of time, right, before the patient is in front of you, then all that intake didn't help. Now, it's probably humanly not possible to look at that, right? Maybe initially you can, but when large volume comes in. So that's where the behind the scene transformation comes, where you have algorithms, you have AI tools who are really bringing it to the front of a clinician where it needs to take action, whether the appointment needs to reschedule, contrast needs to be changed, the patient ate accidentally, or patient is diabetic and fasting, can we move him up the queue or him or her? Those kind of things are 60% operational alignment, 40% technology.
Yeah, no, you said it right. That now before the clinicians were impacted with the EMR adoption, but now with the new transformation, digital transformations that's happening, the patient is now providing you a lot of data that needs to be reviewed, and humanly impossible to do all of that. So AI, ML, robotics are taking charge of the space, and they're assisting the physicians, the hospitals, and kind of creating a situation whereby now you can actually manage all of that data. Is that where you see, how do you see what is the low hanging fruits of AI and ML? And actually, before we go into that, I would like to bring up your pathology, right? The extensive work that you did in digitizing pathology, that was all about using machine learning algorithms and AI to kind of create solutions that had better outcomes than what physicians alone could come up with. I pinpointing those anomalies or issues that separating the normal from the abnormal, right? I think it would be great if you could give an overview to our listeners on how digital transformation of that pathology application was reshaping the pathology landscape. I think that would be a great example of AI transforming healthcare.
Absolutely. I'm always happy to talk about it. It's really, it has been, I would call, my baby for 3+ years before we brought it live. So while I was at HSS, the goal there was really that every other ology has gone digital. Radiology had, given up film for many years, and pathology was still making glass slides, which they still do. But the challenge was that twofold, right? One is that there was no ability to correlate pathology images with other ologies. And, research has suggested, right, the more data points you have, the more imaging you have at the point of diagnosis, the better diagnosis could be made. So there was no ability of correlation. And second was, right, at least in my institution, if you want to look at pathology images, make an appointment, come and sit across a double-headed microscope, right? So I learned about this in a conference, and I was immediately intrigued that how can we bring it in our institution? Only that I learned that there was no FDA-approved product in the United States. It was only being used in Canada and Europe extensively. But nevertheless, we took a leap of faith with our vendor, who had a solution that we will develop a pilot while they apply for FDA approval. And it turned into a long development project between our imaging vendor, with our Epic EMR, and my team. So in the end, what we developed was a first integrated diagnostic system in the country with Sectra product and Epic integrated with the Leica scanner. It allowed a familiar workflow for pathologists. They will work through their work list as they're working the microscope, except it will digitally launch the images. It allows them to launch the pathology, radiology images. It enabled pathology images to surgeons, infectious disease doctors, all clinicians, just like they access radiology images. And then the other benefit, of course, is on the pathology end when pathologist is diagnosing digitally, right? You mentioned the algorithms, the AI, the cell counting. Eventually, it will allow you to standardize your diagnosis across all pathologists because you're working off the same algorithm.
And now it allows the pathologists to work at the top of their game, because all that mundane work now gets done by the AI, by the, the computation that does all the scanning and identifying what is normal, what is abnormal.
And this is where I think the potential is the deep learning or AI algorithms, how they can mimic humans to really analyze complex features. They can process imaging data much faster. And to your point, all the tedious work, this is through digital transformation, right? The digital transformation has been in existence for the last 50 years, but what we did was we transformed paper processes and made them digital. What digital transformation now is doing is eliminating those processes. Somebody else is doing it, things are getting done. And that's the beauty with the pathology. And then huge implications, you look at it from the perspective of they are short in supply and high in demand pathologists. That is one medical specialty where less number of students go in and less number of students come out every year. So think of rural locations. I know Cleveland Clinic has been doing this. They've been capturing the slides in Abu Dhabi and reading back from their office here. Canada has been doing this rural. So there are a lot of, it's the same thing, right? No one is passing paper anywhere. They don't need to pass the glass slides.
Yeah.
It's all available.
Essentially, you're reducing the burden on the pathologist. You're lowering the cost of care, right? And getting better outcomes. So great. I mean, so true that with all this assisted learning and robotics, healthcare can truly be transformed. And if you were to look into the future, say like 2030, what would you like to see if if all of these things that is possible in theory were put into practice? Where do you see healthcare going with those innovations or adoptions? And like you said, people like you have to take that leap of faith with a vendor, because what they're doing is just not perfect either. It's not exactly fitting in what you have to do. You have to work with them to help them create a solution that will work for you, right? So where do you see it going?
And my mantra on this digital transformation is be a little bold and don't be afraid to fail, right? So vendors, I partner with them all the time because I think we all can come together in a common goal. I mean, most recent example is with Zoom, right? So if you want to take a leap of faith, I think digital transformation allows you more leverage than others, because the whole concept of digital is agility, right? You try a little, you can fail a little and learn from it and then move on, right? So one recipe of success in my mind is be bold and don't be afraid, to change your thinking. Or, I will develop my roadmap and somebody else will develop a roadmap, but it's not like really how 5 years ago roadmaps were like the Bible. Not anymore. I wanna validate my roadmap every 6 months, every year, because the ecosystem is changing fast. So if I were to, predict where we will be in 10 years, if last 3 years is any indicator, I think that this accelerated transformation will continue. And then this is probably the right time. I would say a very vast majority of institutions have all the baselines there. They have single EMRs, they have some sort of data infrastructure, and they've been live on those EMRs for years. So there's a stability period. This is really the next frontier. Now utilize all the data you're collecting and take it to next level. So I say that patient experience and engagement and patients' own engagement in their own care will be the primary driver. As more and more patients get fascinated with using this technology and having an ability of access to their data, just like they have access to their banking data, I think we will see a lot more engagement. we will really see what I call really a merging of analog and digital care. Pre-COVID, 90% of care was analog, if not larger. During COVID, we all got a flavor of what digital care can look like, right? And then what we learned also is that provides you an different avenue of maybe treating patients who really don't need to physically see a physician in a more comfortable manner, both for the provider and for the patient. So I tend to see more merging of this, but I also will anticipate this doesn't need to wait 10 years. This can be next 3 years, where the experience of analog and digital is so efficient and seamless for a patient that it doesn't make a difference. I think the regulatory landscape will change. It is so funny, like in March of 2020, this is like just before the lockdown started, I had a meeting on use of telehealth, and then they told me that it's not reimbursable today, the telehealth visit. I said, maybe they will change. And maybe I should have asked for $1 million that day, because the next day the regulation came, there is a temporary approval. So
Right.
how quickly? But so in certain ways that accommodation continues, but I think regulatory landscape will change. Consumers have been exposed to digital experience in every aspect of their life. And now they got flavor of healthcare being digital. Some don't like it. Some didn't experience the same way, but a vast majority are planning to continue to use it. But I think that's an important piece. Some didn't experience the same way. And I know you were at HIMSS, and I think we all heard about the keynote address that 24% of North Carolina's population is without broadband internet. So what
Right.
pandemic,
How do you?
exposed is the digital divide we have, right? And it ended up, while every institution saw a jump of virtual care visits, but it created more disparity. So now every vendor is trying to address this by using the lowest common denominator, right? Maybe a text interface is enough. Maybe you don't need to download an app and launch a video and all those things. So I think that's where it's changing. And consumers also don't want to really go through the process of logging in and giving data and then accessing information. One other thing, I think it's taking root, the concept of customer in healthcare. CRM solutions have been slowly making way to the progressive institution. Now I think it's going to become a norm. We all in healthcare have an excellent process and infrastructure to manage patient data. We don't have anything equivalent to manage a non-patient today. And that's the consumer, right? Before they become a patient. So that concept, I think, will become a norm over next decade or so.
I mean, healthcare versus sick care, right? Today, we are just taking care of sick care, but you're saying, let's take care of the wellness. Stay well, don't become sick. And how do we help you stay healthy?
Yes, absolutely. Because, the regulatory environment is shifting. The pay-per-use model will be prevalent. We all know about accountable care, and that's a good model, right? There's some accountability, but I think you made a good point, right? The sick care is transforming into preventive and wellness care, and more engaged consumer is the one who's going to drive this. They're going to push the envelope further.
And give that responsibility. Right now, the responsibility of keeping the patient healthy lies with the doctors, right? It should be that the patient should take should be taking equal responsibility to stay healthy, and it's possible for them through their diet, their exercise, their keeping everything so that it doesn't progress towards the sickness or their longitudinal. All of us are going to get chronic diseases in the end. Most seniors have something or the other. Many have multitude of chronic diseases that they have a burden of, right? How do we keep that at bay? How do we keep the people, prevent them from getting these diseases? And
that's where you made a very good point here, right? This is where the digital transformation can be a game changer. So instead of going for once a year wellness visit, there are several other avenues to communicate those wellness tips to you, which you will consume, right? I mean, I get mailers at home, and we get emails. Now nobody reads emails these days except at work. But now, a text message or your iWatch gets the jiggle, please get up and move, or so those things, IoTs. I think that's where it is going, right? So we're not relying on single model of once a year wellness visit. That's where reimbursement models will change. Like today, RPM is reimbursable. So all remote patient monitoring, right? And other such things may come in play.
Yeah, no, I think we covered so many different things and I really learned a lot. I really liked one of the messages that you sent out to, startup innovators saying, be bold, don't be afraid of change that you're thinking. And this is a message not only to startups, but also to the enterprises, to the provider systems, the leadership that is not many. I mean, you are at an organization where you're driving that change, but a lot of organizations are still behind the curve and they need to adopt those changes and be bold and drive that change. It's okay to make a mistake, but it's the change that will help you leapfrog ahead of the thing. I know that I'm sure there's some specific area that we haven't talked about or we've not covered today. Is there anything that you wish to share with listeners that we haven't had the opportunity to bring up?
I think we covered most. I know you initially talked about hurdles, and I didn't quite address that, or we moved on to the next question. But as I am learning from my own experience about the various hurdles which may derail your digital transformation strategy, I think a data is key, and not just having a data, an ability to mine across structured, unstructured, outside sources, because that is a key in driving the right decision making. So every organization who is thinking about transformation needs to start worrying about the underlying data infrastructure, right? Whether it's your data lake, whether it's your data warehouse, or how are you assembling the data, that's the key. We talked about really, be bold. I agree. And as I touched upon, right, just learn to experiment quickly and, be open to failure. Because, and I am educating my colleagues or giving the message out that, we are dealing with a different ecosystem here. Everything may not be successful, but we will not wait 18 months to find that out. We'll probably find that out in 2 or 3 months. So it's a little investment of resources, little investment of time, and maybe we'll get out some learning out of it. So every organization and leader needs to think from this perspective that we are in a fluid environment. Things are not settled, right? You partner with a vendor today, and 3 months or 3 years later, they get bought over by a bigger client, or discontinue the product. That can happen. That has happened to us all along. I mean, in the last 15 years, I can look at several vendors who sunset their product, got bought over, all those things. So it will happen. It's sort of Silicon Valley infrastructure penetrating into healthcare right now with a lot of startups, and because digital transformation is across the industry.
Yeah. How much? $30 billion invested in healthcare in startups last year. Amazing amount of money. A lot can be done with that. And you said it really well. Status quo is not an option. Fear is not an option. Failure is okay, because through failure, you're going to learn something new and you're going to adopt something new. And maybe you're going to transform healthcare through there. So I agree. Thank you. Thank you very much for all that you shared with us today, for taking this time to chat with us, and for sharing your knowledge on digital transformation in healthcare, especially when it comes to driving digital and connected healthcare. Right? It was such a knowledgeable session for all of us. I learned a lot for sure. And I'm sure your advice is going to stay with us through the transformation journey of the healthcare sector. And
I enjoyed our conversation very much. Again, this is a topic near and dear to my heart, and I'm right in the middle of it. So it was perfect timing for this session. And I look forward to collaborating even further.
Yeah, we have to have you back again and discuss in greater depth all the AI and ML and pathology transformation that you helped bring about just a short time ago. And before I end, I want to say thank you to the audience also for listening. Don't forget, we do have show notes, and that will have links and resources and contact information related to today's show. And so stay tuned for more Care as One podcasts and discussions on trending healthcare topics that you care about. And send in your suggestions on speakers, topics, and we will try to address them. And have a great day. And thank you once again, Inderpal, for being with us here today.
Thank you so much, Dipti, and thank you to all the audience for listening.